The Centers for Disease Control said today the distribution of H1N1 vaccine is accelerating. More than 35 million doses of the vaccine have been distributed around the country to date. But we learned today that some Wall Street firms have gotten the vaccine to give to employees who are at high risk for the virus. That news did not sit well with many doctors and hospitals who have yet to get any vaccine. So here's David Muir. David?
Charlie, as you know, federal and local authorities were quick to point out today that those banks and businesses that got the shots have been told to give them out the way they're supposed to high-risk employees first. But when you've got patients at doctors' offices and hospitals waiting for shots that haven't even arrived, you get a lot of people asking, is this the best way to get that vaccine out? With long lines before dawn in Indianapolis.
We've been here for maybe a half hour.
40 minutes, 45 minutes.
This woman in Texas waiting since 3 a.m.
Because it was important.
There is growing anger over where and how the H1N1 vaccine is being distributed, especially today with news that Wall Street banks were among large businesses that got shots before some hospitals and doctors' offices. Goldman Sachs, 200 doses. Citigroup got vaccine too. So did the Federal Reserve Bank of New York. Today, the White House said local authorities would be issued an urgent reminder about who gets priority.
They should. So basically, Goldman Sachs should not have gotten any until the hospitals had gotten it.
This is a decision that is a decision that local officials made. If there's somebody that is not in a priority group that is getting the vaccine, that is obviously a problem.
Banks and large employers have been given shipments of vaccines before to help get it out to the private sector. But when you've got patients waiting in doctors' offices that haven't received any vaccine, it doesn't look good. And today, the head of the CDC sent this to state and local authorities. I ask each of you to review your plans immediately and work to ensure that the maximum number of doses is delivered to those at greatest risk. Late today, New York obstetrician Narissa Gubala was still waiting. With dozens of expectant mothers as patients, she still hasn't received her first shipment. When you read the headlines that Goldman Sachs, Citigroup, some of these other corporate entities have received the H1N1 shot and you haven't, is it frustrating?
Oh, it's angering.
No, actually, it hasn't come in yet.
Another person frustrated that they can't find the shot?
Absolutely frustrated.
Courtney Washkowitz is one of those expectant mothers today, only to hear there is still no H1N1 vaccine.
It's definitely frustrating. I mean, I think we're at the top of the list.
In fact, Morgan Stanley received 1,000 doses of the H1N1 vaccine. Today, the bank said they never thought they would have received those doses ahead of the hospitals. So those doses, in fact, have now been donated to a New York Children's Hospital. And this evening, the New York City Health Department maintains it did distribute a vaccine to doctors and hospitals that could vaccinate large numbers before the banks. But so many doctors told us today, Charlie, that the system clearly is not working.
David Muir reporting tonight.